It is of utmost importance to find microbiological diagnosis of tuberculosis before we start treating any case of pediatric TB. In the older days, the samples used for such microbiological diagnosis was either a sputum or a gastric aspirate. However, these are not very sensitive as well as specific samples in order to diagnose this bacteria. Pulmonary tuberculosis still stays the most common type of tuberculosis in kids. However, other kinds like pleural tuberculosis or tuberculosis of mediastinal lymph nodes is also seen very commonly in this age group. If you have a strong suspicion of tuberculosis infection based on history and clinical examination, but your sputum as well as gastric aspirate samples are negative, we better proceed to more specific ways of getting the samples for microbiological diagnosis. These samples involved bronchoalveolar lavage in case of pulmonary TB, pleural tissue biopsy in terms of pleural TB, or mediastinal lymph node biopsy for mediastinal lymph node TB. Note that the sensitivity as well as specificity for diagnosis pleural TB by pleural fluid examination is extremely poor. The reason why we should be so proactive in finding microbiological diagnosis of tuberculosis is only because of the ever-rising prevalence of multi-drug resistance tuberculosis. This is Dr. Kaustubh Moite, your pediatric pulmonologist, in episode number 49 of Daily Doctor Dose. Thank you.